This is a presentation on male genitourinary disorders by Jennifer Hull. The objectives of this presentation include discussion of a few diseases of the male genitourinary system, to include benign prostatic hyperplasia, prostate cancer, and erectile dysfunction. For each of these conditions, we will discuss the causes, the pathophysiology, drug treatment options, patient monitoring, and patient education. First, let's discuss BPH. BPH is an enlarged prostate gland which, as the size of the gland gets bigger, it may result in problems urinating. The causes of BPH are not very well understood. Research suggests that decreased testosterone results in higher levels of estrogen, which in turn increases activity of cell growth. A hormone called dihydrotestosterone continues to accumulate as testosterone levels decrease, causing prostate cells to continue to grow. There are, however, risk factors that can contribute to this condition. These risk factors include family history, obesity, sedentary lifestyle, history of erectile dysfunction, and aging. Enlargement of the prostate gland occurs as a normal aging process. In the case of BPH, the prostate gland becomes enlarged but remains non-cancerous. As the gland continues to grow, it begins to crowd the surrounding structures, causing symptoms of BPH. Common symptoms for this disease include difficulty urinating, a weak stream of urine, and a feeling of fullness in the bladder shortly after urination. Drug therapy for this condition includes the use of alpha blockers, 5-alpha reductase inhibitors, combination therapy, or over-the-counter phytotherapies. Alpha blockers work by relaxation of the prostate and the bladder muscles. This process reduces the symptoms of BPH by decreasing blockage of surrounding structures, thus increasing urine flow. 5-alpha reductase inhibitors work by blocking the male hormone DTH. DTH has a great influence on prostate growth. Combination therapy of these two types of medications can be beneficial by having an increased effect on symptoms than if used alone. A disadvantage of this combination therapy includes the risk of experiencing more side effects of medications than if used individually. BPH is monitored, but there is no active treatment. Your doctor will observe your condition through a process of watchful waiting. He will look for new or worsening symptoms, and you will begin treatment as soon as symptoms become bothersome. If medication therapy becomes ineffective and symptoms begin to worsen, then there are several surgical options available to treat this condition. Be aware of the symptoms of BPH so that when you begin to experience them, you can be seen by your doctor. Next, let's talk about prostate cancer. The causes of this disease are unknown, however, a few risk factors have been known to be associated with this condition. These risk factors include being elderly, being of African American race, a family history of prostate cancer, or obesity. Prostate cancer occurs when cells in the prostate become abnormal. The abnormal cells grow and divide at a rate faster than healthy cells, causing healthy cells to die off. A tumor eventually forms from these abnormal cells and takes over the surrounding tissues as it grows. The abnormal cells can move throughout the body and spread to other organs. Drug therapy for prostate cancer includes chemotherapy, biological, or hormone therapy. Types of hormone therapy includes the use of anti-androgens and luteinizing hormone-releasing hormone. Other treatment options for prostate cancer may include radiation therapy, surgery to remove the prostate, or freezing of the prostate, which kills cancer cells. Prostate cancer can be detected when symptoms are evaluated. If diagnosed early, your doctor may suggest a period of watchful waiting, to include frequent blood tests, rectal exams, or biopsies to monitor the progression of the disease. Rectal exams are beneficial in detecting abnormalities in texture, shape, or size of the gland. Prostate-specific antigen levels in the blood are important in monitoring this disease. PSA is a substance produced by the prostate gland in which high blood levels may indicate infection, enlargement, or cancer. In prevention or managing of this disease, a healthy diet comprised of fruits and vegetables is important. Also, healthy foods rather than supplements are encouraged. Be sure to exercise and maintain a healthy weight. Also, be sure to involve those who you are close to help you through the treatment process. It may also be helpful to talk to other cancer survivors so that you can get insight on what is expected or have a support system from someone who has been through what you are going through. Lastly, let's discuss erectile dysfunction. Erectile dysfunction is a condition involving the inability to obtain or maintain an erection. Physical and emotional effects on the body can contribute to this condition. Erectile dysfunction happens when imbalances occur with the brain, hormones, emotions, nerves, muscles, or blood vessels. One or many issues with these functions is what results in difficulty having or maintaining an erection. Medications used to treat ED include Viagra, Cialis, Levitra, and Stendra. These meds target nitric oxide in the body and increase its effects on the signals required to form an erection. Nitric oxide is a naturally occurring chemical that relaxes muscles in the penis. Relaxation of muscles allows for increase in blood flow. Sexual stimulation is still needed in order to release the nitric oxide from the nerves in the penis. Side effects of these medications may include flushing, nasal congestion, headache, visual changes, backache, and upset stomach. When being evaluated for this condition, your doctor will first take an accurate medical history and you will need to complete a sexual health questionnaire. Further workup may be needed in order to identify any underlying conditions. Patient education for ED includes making changes so that you are living a healthy lifestyle, in addition to treatment and management of other health conditions. Reducing and managing stress is important, as well as reassurance that the lack of interest is not the problem, rather emphasizing the importance of communication with your partner about your condition. This has been a presentation on male genitourinary disorders by Jennifer Hull and partial requirements for Nurse 5372 for the University of Texas at El Paso Masters of Nursing Education program.